In today's video, we will discuss about tumors of nasopharynx. The topic of this video is Juvenile Nasopharyngeal Angiofibroma, that is JNA. This topic will be discussed under certain headings. By the end of this video, you will know everything about these things. They are etiology, site of origin, spread of tumor, pathology and growth of tumor, and role of hormones and genes in growth. Role of hormones and genes, extensions of nasopharyngeal fibroma, clinical features, endoscopic examination, diagnosis as well as treatment. Etiology. If we can just remember the full form of JNA, you can write the etiology. The full form of JNA is Juvenile Nasopharyngeal Angiofibroma. Juvenile indicates that it is seen in adolescent male. Nasopharyngeal indicates the origin of tumor, that is nasopharynx. The tumor is present in nasopharynx area. Angio indicates that vascular tissue, and fibroma indicates that stromal cells growth. So let us discuss this in detail. Such patients the adolescent males have a hematomatous nidus of vascular tissue in the nasopharynx. Hematomatous nidus is a Greek word. Hematomatous means benign. This is a benign tumor. Nidus means bacteria grown area is known as nidus. So this hematomatous nidus will develop into angiofibroma when male sex hormones appears. Site of origin. The tumor arises in nasopharyngeal area, but the exact location is posterior part of nasal cavity close to the superior margin of sphenopalatine foramen. Let us look that in a diagram. Here, this is known as sphenopalatine foramen, and posterior part of nasal cavity, this is our nasal cavity, this posterior part, as well as superior margin of sphenopalatine foramen. So the tumor lies here. Spread of tumor by following routes. So there are 3 routes for spreading of tumor to different areas. It can spread through nose, nasopharynx, or through fissures and foramina, such as foramen rotundum, Vidian canal, or inferior orbital fissure, or palatovaginal canal. The second route is by expansion and pushing the structures. So it pushes the nearby structures such as posterior wall of maxillary sinus in the pterygopalatine fossa. The third route is by infiltrating and destroying bones such as at the root of pterygoid or greater wing of sphenoid. All these things we can see those fossa and foramina in this diagram. See the pterygopalatine fossa, pterygomaxillary fissure, terrain, and let us discuss further about pathology and growth of tumor and role of hormones and genes in growth. On gross appearance, it appears in reddish to purple in color, sessile mass covered with mucosa. Tumor lacks capsule. Microscopically, it is made of vascular tissue and stromal cells. As the name suggests, angiofibroma. Vascular tissue is endothelium-lined spaces without any muscular or elastic fibers. So this is the reason why when you even touch the patient having this JNA at that area, just one small touch, because of lack of due to lack of muscular or elastic fibers, there is immediate epistaxis. Stromal cells are spindle-shaped cells and lay down collagen. Role of hormones and genes. 75% of tumors show androgen receptors, accounting for growth in males at adolescence. Several growth factors have been implicated for the growth of tumor. The tumor is seen 24 times more frequently in patients with adenomatous polyposis of colon. So these are the 3 points you should remember for to know the role of hormones and genes. And let us discuss about extensions of nasopharyngeal fibroma. It can extend into nasal cavity and nasopharynx, paranasal sinuses such as maxillary, sphenoid and ethmoid sinuses, pterygopalatine fossa, temporal and infratemporal fossa in cheek, as well as to Orbit's cranial cavity. It can extend to anterior cranial fossa through roof of ethmoids or cribriform plate, and middle cranial fossa through erosion of floor of middle cranial fossa, or indirectly by invading the sphenoid sinus and sella turcica. Clinical features. Age and sex. It is seen in males between 10 to 20 years. Nasal and nasopharyngeal. It is profuse, recurrent and spontaneous epistaxis is most common presentation. Nasal obstruction and denasal speech, nasal discharge are the symptoms that are seen in nasal and nasopharyngeal area, and the otologic symptoms or ear symptoms are conductive hearing loss, otitis media with effusion, and ophthalmoneurologic symptoms include proptosis, diplopia with involvement of 2, 3, 4, 6 cranial nerves depending on the extent of tumor, and the facial symptoms include broadening of nasal bridge, swelling of cheek, frog face deformity. Endoscopic examination reveal the tumor is present in nose nasopharynx with blood stained discharge. It is lobulated or sessile. Obstruct one or both JNA. Diagnosis: contrast enhanced CT scan, MRI, digital subtraction angiography. Embolization of vessels can be done at this time to decrease bleeding during surgery. Treatment: surgery for recurrent so JNA. If it is recurrent, then we consider radiotherapy, chemotherapy and hormonal therapy. If it's seen for the first time, then we will go for surgery. And thank you for listening.